Yay.
Great. Just learned
Perfect.
a new thing from Jackie Ralph. So, hello everybody. You can't see my face because we're reducing bandwidth by reducing me to a West Gray logo. The smiling face you are seeing is that of Jackie Ralph, who is a Priceville native, but she leads up the youth team at the Canadian Mental Health Association, Grey Bruce Branch Mental Health and Addiction Services. And I'm a huge fan of Jackie's. She and her team have been on the road, I don't know, for years now, with programs for everyone from preschool through high school, and they speak to over 20,000 students and adults in a year. I met Jackie through We Care, the We Care project, when I was with youth literacy, and the project promotes youth mental health and prevention of youth suicide. And their We Care Share event is like one of the most fun you can do if you're anywhere between 11 and 300. So I love seeing Jackie's energy and her enthusiasm and her good, grounded, common sense advice and suggestions and recommendations and vision. So with nothing more to say, I'm going to hand this over to Jackie and enjoy your hour.
Awesome. That was like the best introduction ever. And I would think a lot of that you said is right back at you. So I love that. Well, thank you to anybody who's tuning in and watching this afterwards. Thank you so much. What we're going to do is we're just going to start trucking along. And the very first thing I got for you is, like Kim said, this is just a little bit about me. So yes, I grew up in the huge metropolis of Priceville, which for many people, they may remember it as a place they got a speeding ticket because it is a little bit of a hill. And I went to McPhail, I went to Grey Highlands. So I grew up here, went to school here. I am part of the McIntyre clan from Glenelg, which, cool fact, Glenelg is the only palindrome municipality township in all of Ontario. So that's pretty cool. It's about the same forward and backwards. And so that's my cool family there. And then I do have one famous relative, and he is the very handsome fellow in the plaid shirt. And his name is Larry Robert McIntyre. And if you follow along on Facebook, Grey Bruce Stormwatch updates, you may know him from sending his updates onto the Facebook page. So he's a pretty cool ducky, very handsome fellow. And yes, I have been working at the Canadian Mental Health Association, Grey Bruce Mental Health and Addiction Services. That's 11 words in our name for 17 years now. I started as a volunteer. I volunteered with the puppet program and then became the coordinator of it a year later and have been doing that ever since. And like Kim said, we use the puppets to talk to kids kind of grade 5, 6 down. We go right into classroom by classroom for the grade 6s and up. Ideally, what we do is we go into a school for a whole year and we visit on a month-by-month basis, talking about all sorts of things over the course of the year, or we do some one-offs, kind of like this kind of thing. So basically, we're just happy to talk to whoever will listen to us. And then as a side, I love to sing. So I tend to sing as I talk. You may notice that every now and then. And that's comes from my love of karaoke. So this is me last year when I was doing my parking lot concerts for the seniors. So I think this one was at Lee Manor. Just have fun singing with my seniors. I just love it so much. So this slide made a lot of sense to me. I don't know if anybody else can relate, but I kind of start to understand why my cats always try and make a break for it every time the door opens, because that's kind of what it's felt like this last year, is that we've been kind of cooped up and now we just want to get out and do things again, and we just want to escape because it's been a little different. I know for me, I turned 50 this year and I had huge plans. I was going to go to Newfoundland. I was going to have a great time. But you know what? Newfoundland will still be there next year by the time I get it all planned again. And when the pandemic first hit, I honestly, I thought there's no way we can do puppet shows. If we can't be in the same space as the kids, we're probably gonna have to have a few months off and just wait till things get back kind of trucking again. And it honestly only took about a week before we got our first phone call that said, hey, can you do a puppet show into the classroom through the Zoom or through Teams? And we're like, I don't know, let's give it a try. We don't know till we try. And it's actually been really great. We just love it. It works out. It's kind of like our own little Muppet show, with each little square having a puppet character in it. And then we can talk to the kids that way. So yeah, up until this year, last year, I thought Zoom was a speed or something dogs do at the end of their leash. But boy, do we know different now. So it has been quite the time. We hear a lot, oh, it's a marathon, not a sprint. So you can't go too hard. You got to pace yourself, which is a really great message in general, but certainly a message that we have these days. But I often think of Forrest Gump here, when he went for a walk, and he walked and he walked and he walked and he walked for 3 years, 2 months, 10 days, and 14 hours. And he finally stopped and looked at the audience behind him and said, you know what? I'm tired. I want to go home now. And that's kind of what this last 15, 16, 17 months has felt like. We just want to get back to the way it was before. But we just know it's going to be different as we move forward. We're still going to be learning new things and doing new things. So how do we exist and take care of our mental health within that? So when we talk about mental health, we always want to make sure we're talking the same language. Are we using the words in the same way so that we're all communicating the same thing? We always start with a definition. And when I think about mental health, when we talk to your kids, we always say mental health is the thoughts in your brain and the feelings in your heart. And we all have a brain and we all have a heart. Therefore, we all have mental health, all of us. And our goal at CMHA Grey Bruce is for the folks in our communities to have the best mental health possible. And what can we do to support that? But what does good mental health look like? Well, there's kind of two things in there, right? It's the ability to enjoy your life. So when I got up this morning, I'm all excited. I'm going to get to see Kim. It's been at least 2 years. And I was just so stoked to hang out with Kim. I was so excited. But then, there are some days when I get up in the morning and I'm like, oh, if I have to do one more puppet show, there's some days it can feel like that. So ideally, we want to be somewhere in the middle, where when we get up, we're excited for our day. We're excited for who we're going to see, what we're going to do, who we're going to talk to, something new we're going to learn. That's the goal we're kind of aiming for. And there's the two things that make that easier is our feeling of our own self-worth, and that somebody else sees that, and how able do we handle bad stuff? So when life throws us a left on the roundabout and we were totally heading right on the roundabout, how quickly do we get back on the roundabout and get back on track again? How quickly does that happen? But I actually prefer this definition. So it's not so much a definition from a dictionary or a library book. It's actually John Lennon. He remembers as a kid, a teacher asking him, well, Mr. Lennon, what do you want to be when you grow up? And John said that he remembered telling the teacher that he wants to be happy. And he remembers the teacher kind of looking at him sideways going, well, maybe you don't understand the question. And John Lennon looking sideways back at his teacher going, well, maybe you don't understand life. Because regardless of what I do as a career, where I live, who I cohabitate with, I want to be happy doing all of those things. And he is absolutely correct. However, we also know good mental health isn't just the goal of being happy all the time. Because if that's where we're setting our bar, we got to be a little careful with that. Because good mental health is about experiencing all the feels. We're going to have all the feels. We're going to be excited. We're going to be frustrated. We're going to be angry. We're going to be sad. That's just the way life is, because there's lots of things that come at us that make us feel all of those things. Sometimes there's some stuff that comes at us that makes us feel all of those things at the same time. So then how do we manage all those different feels? And what does it look like when maybe our mental health isn't as good as it maybe was the day before, or 18 months ago, or a couple of years before that? So one thing that can affect our mental health, and we hear about a lot, is stress. One of those feelings that can get overwhelming is stress. But stress often gets a bad rap. the right amount of stress is actually helpful. It can be, a motivator. It can be a good kick in the pants forward if I need it. If I need reminding that leaving my dishes out on the counter for a couple of days probably isn't so good for the fruit fly situation in the summer, right? That's sometimes how stress can be helpful. But we don't also want it to get overwhelming, that it comes between us and doing our day-to-day things. That's not really helpful either. But the flip side is sometimes if stress is feeling overwhelming and it gets too big, we sometimes shut it off and we try and numb those feelings that we're experiencing. This can sometimes be mistaken for lazy. That's what we hear sometimes when people say, oh, they're just lazy. Well, is it that the stress has become so overwhelming that we just honestly don't even know where to start? So you put all that together, you shake it around, and what it really means is we all have this sweet spot when it comes to stress. We all have this kind of balancing point where it's not too much, it's not too little, it's just right. Kind of like Goldilocks and the Three Bears. We all have that spot that's our comfort spot, and it's different for everybody. So we take all that and we throw it into a triangle. And this is kind of how it looks. This is our mental health triangle. So overall, at any one time, 70% of us were doing okay. We got up this morning, we brushed our teeth, we put on outdoor pants, we got some breakfast into us, we made our coffee, we got to work, we felt productive, we're doing okay. But at any one time, 10 to 15% of us are experiencing what we call a mental health problem. So the way I look at a mental health problem is that tends to be situational. So that tends to be something that's added to my life or taken away from my life that usually is not my fault. And sometimes it's not something I even asked for. It just kind of happened. And for a little while, it's causing me to not feel like my normal self. So I know for me, every August, it's been 18 years since my dad died. So I think of when my dad passed away, there is definitely a couple weeks. I don't want to be doing puppet shows. I don't want to talk to people. I just want to be home and I want to be sad. I just want to feel, I want to be in that grief. That's my time to feel those things. But ideally, in a couple weeks, I start to move towards back to how I felt before. I start to go back to work. I start to get back to my puppet shows. But if after a couple weeks, I'm not starting to find my groove again and get back into the old way of things again, well, I hope somebody's calling and checking on me, because that's a sign that maybe my brain isn't helping me bounce back as quickly as it could. So maybe I'm getting into mental illness territory where just a pathway in the brain just isn't working the way it's supposed to, the way it's intended to. So that's our triangle. That's our mental health triangle. And this exists everywhere. It doesn't matter. In a community, in a household, in a friendship group, in a family tree, in a classroom, in a workplace, doesn't matter. This is our mental health triangle. But then 18 months ago, something strange happened. And what happened to our triangle? It flipped completely upside down. And so CMHA National, Canadian Mental Health Association National, did a few surveys, and they asked people about their mental health throughout the pandemic. So a year ago, May, around Christmas time last year, and then most recently in May again for Mental Health Week. And what they found was really eye-opening. And they found that actually it had flipped. So here is 77%, right? So if we go back to the triangle again, so it was 70% before in the bottom, well, 77% are actually now in the middle and the top. And so here is a big chunk of people saying, you know what? I'm feeling a lot of negative stuff, whether that is stress, whether that is grief, whether that is anger, whether it's boredom. There's all sorts of things in there. And that only 23% could actually identify at the bottom as, you know what, I'm not doing too bad. Maybe I'm more introverted than I thought. Kind of like in the Netflix, kind of like in having more time with my family and getting outside. You know what? And there's lots of cool people doing good stuff. that are going to help us get out of this. So I found that really interesting. And when we look at some of the other numbers, there was a big group of people that said, regardless of all that's going on, 50% said, I'm having trouble just seeing anything positive, period, right? And then the other thing we noticed was a big majority of folks could say, you know what, if I was struggling before, I'm definitely feeling the effects now as well. And so that was something we kind of would expect, right? That somebody that maybe was having trouble connecting to the right stuff before is definitely having trouble connecting in these times. However, when I put that with the bottom of the triangle, those two things sometimes also identify with each other. So when I think about how our triangle has flipped, if I switch that over, we got to hear from a young lady early on in the pandemic. And she is a young lady who struggled with anxiety, obsessive compulsive, a lot of social phobias. And for her, getting out was hard 2 years ago, 3 years ago. And she said, you know what? In the middle of the pandemic, all of a sudden, things were easier for her. People could deliver stuff to her house. She didn't have to go and get things. She didn't have to go get groceries anymore. She actually didn't have to leave her house to go see her counselor. She could talk to her counselor over the phone and over Zoom. So here was somebody now in the bottom of the triangle who'd been at the top. And she said, interestingly enough, there was maybe some people in her life before who thought of her as lazy, or who thought, oh, you just need to get out a little more and you'll feel better. And all of a sudden there was folks calling and saying, wow, I just need to call and say, I owe you an apology because I'm experiencing things I've never really felt before, or didn't think I would, or didn't think were possible. And they were calling to say, I understand, right? And that really went a long way with her. So I think of that when I put the two together, that when 41% said their mental health had declined, that meant there was actually some folks who were actually able to get the help in a way that worked for them. And when we look at the folks that really struggled during the pandemic, you're going to see two things when we talk about families and children and teenagers and supporting mental health. Those were the groups that struggled the most, where our kids, our 18 to 24-year-olds, our social butterflies who need to be out making friends and trying new things. That was a group that really had some challenges. And then our LGBTQ plus community, our 2S LGBTQ plus community, maybe they lost connections to some of the helps that were really helping them, their GSA at school, a teacher that they really connected with, and now they were missing out on those supports. So that was another group of folks who identified in that survey. So we put all that together and we come to this chart. So this is from Kids Help Phone. And they said, overall in 2013, we knew that there was stress already. Kids were feeling stress from all sorts of directions. And so there was about, just under 20% of guys, a little over 30% of girls, and overall just over 22% in general. Well, then in the middle of the pandemic, look what happened. Here goes our numbers. And so they, through the calls that came into Kids Help Phone, they said, if we do the math, overall, over 44% were identifying that stress level had really gone up. And there was lots of pieces in that: family, school work, just anxieties around COVID. And that was really interesting for them to see. But out of all of that stats, there was one stat that went down, and it just wasn't, they chatted about it on the webinar, but they didn't have it in their graph. And they said of all the things they helped kids with on the phone, one of the most common questions was around bullying, right? If kids were experiencing bullying in their schools. Well, guess what one topic was that went down on Kids Help Phone while we were homeschooling was actually bullying. And that one fell off the list. It became less than the top 10. So again, some silver linings in all of this. But overall, out of all the calls that came to Kids Help Phone, they did the math and they said, out of all across Canada, out of all the kids that are under the age of 25, children and youth, about 1 in 4 reached out to Kids Help Phone in some way. That we can look at that and go, wow, that's a lot of kids really struggling. But we can also celebrate that and go, wow, that's a lot of kids that knew this was a place they could get help and talk to somebody. There still was a big chunk of kids who called that said, you know what, if I had called the Kids Help Phone, I don't know who I would have called. I don't know where I would have gone for help. So how amazing that so many kids were able to find the Kids Help Phone number on their Smarties boxes and make the call, that they knew at least that was a place to start. When the survey was done at CMHA National, the one thing they did ask them was, okay, based on where you identify with how you're feeling, what is it that's keeping you here, right? You're still here today. So what's helping you cope? What's helping you get through this pandemic? What are your go-tos? Well, I don't know if you identify with anything on this list, but I know I sure do. So I spend a lot more time in front of my fridge and Netflix, expecting to find something new inside it. Anybody else? So yeah, we spend a lot of time binge watching our TV shows and binge eating what's in our fridges. And then the other thing they noticed too was, again, if there was folks that were using substances to manage before, they were definitely using substances to manage now, if not more. And that's something we absolutely see in our communities. There was a big emphasis on shopping, and people said, you know what, it's one thing to shop for what you need, but I'm definitely shopping for things I absolutely have no need for, just for the fun, just if somebody come to your house, right? Beep, beep, beep. Visitor, what's coming down the driveway? Ooh, what's in the package? But it was helpful. It was working. And yeah, I identify with a lot of those things. The group that identified in the bottom of the triangle, you know what? I'm not doing too bad. I'm getting through the things. I'm actually learning lots of stuff. There was things on their list. So they were still doing the things on the other page, but they maybe were adding in these things. So stuff like getting outside. Boy, it took a pandemic for this gray Bruce person to actually get on the Bruce Trail. I've lived here all my life and I hadn't been on the Bruce Trail till the pandemic started. There was lots of folks adding in exercise at home, turning their basements into gyms, ordering Peloton bikes. I think for a little while there was an 11-month wait to get a bike at home. People were connecting any way they could. Zoom calls, Skype, writing letters, sending packages, dropping off. I think there were some ninja things that came and showed up at people's porches. That was really cool. Starting to have a new hobby or bringing one out that they hadn't done in a while. And a bunch of people said, you know what? I can get really stuck in negative news, whether it's on Facebook or CNN or in the paper, on the radio. And so what another group of people said, you know what, I catch up in the morning, I listen to Diana Mater on the radio, I get the news, and then I turn it off. And then I just focus on me the rest of the day. So that was really helpful to a lot of people. And the other thing that I really appreciated was this one here. And they said, you know what? I actually see the time as a gift to find out more about me. What is it I like to do? What is it that I'm good at? Should I go back to school? Because, gee, it's kind of easy right now to do it from home. Should I be learning something new? And a lot of folks identified in that space too. So as Howie Mandel says, it's really interesting the narrative that has changed around self-care. And he said, you know, we sometimes historically took better care of these things than we took care of this thing. He said, isn't it funny? When you're a kid, you get given a dentist, optometrist, a doctor, you get your sound checked, your hearing checked. We do things around our literacy, how's our reading, how's our math. But he said, why don't we have regular mental health checkups? Why aren't we just doing it regularly, like we go get our teeth checked and cleaned and sorted out? He said, why do we wait to look for that mental health support after we're sick. And he said, wouldn't it be better if we all just were connected and had opportunities to do that mental health checkup? Could we identify things earlier? And then when we're maybe not doing so great, we know exactly who to call. Like our dentist, we don't go to get cavities, we go to prevent them. And that always resonated with me. I always appreciated that message. So what did we throw in the presentation? Well, what's part of a mental health checkup? What does it look like? Go figure. Number one, do you like who you are? When you look at yourself in the Zoom camera, do you like who's looking back? Are you okay with that person, with that face, with those two eyeballs staring back at you? And that's the biggest part of good mental health. Do you like who you are? Are you comfortable in your skin, right? And when I think about good old Garfield there, Garfield has a really, okay, he is a little narcissistic. And yes, he is a fictional character. But you know what? If somebody were ever to come up to Garfield and say, hey, chubby, you know what? I don't think it would affect him, because I think his response would be, yep. Did you bring more lasagna? And so when I think about that number one, liking who you are, and we think again about bullying, that's what makes you bully proof. When you're okay with you and all the bits and pieces and all the parts that make you you, that's what protects you from all of that. So, you know, I always say to the kids, how boring it would be if we were all exactly the same. Normal is just a setting on a washing machine. And to be honest, we only use it half the time because we're always setting it at different things. And I tell the kids, you know, it's okay that I'm a bad cook because I keep restaurants in business. So it works really well. We're all different. And that's what makes the universe and this globe and this place that we put our feet on so incredible. So the other, the really good poster child for this to me, when I'm trying to describe what that all looks like, is I use Lizzie Velasquez. So I've plunked in here a YouTube link, or you can just search Lizzie Velasquez, and there's a TED Talk that she has. So this is a young lady who's one of only 4 people in the world that lives with lifo something, something, something. It's a really long name. And basically her body has trouble creating tissue. And there's lots of different types of tissue in our body. And so literally she is bones with skin over top. And so she looks a little different. And she remembers going into kindergarten class. She'd been raised with parents that are like, well, Lizzie, this is one part of you, but it's not all of you. So you got to find other things that make you you. And she did. And she got to learn about things she liked to do, what she liked about herself. So she gets to kindergarten and the kids are looking at her and are like, and nobody wanted to play with her. And she was like, okay, well, I'm going to be in the corner playing Legos because I like Legos. So if you want to come play with me, cool. If you don't, that's cool too. But the great thing was 2 or 3 kids went over and played Legos. And she got to have friends, and she really appreciated who she was. And then she got onto social media, and somebody took a picture of her, or took the picture of her on her social media, right-clicked, saved image, and then turned it into a meme. And so this was the picture that went out on social media with the words over top of it, "This is the ugliest woman in the world." And that image was shared 4 million times, 40 million times. And in the TED Talk, Lizzie says, you know, that was hard. That 40 million people thought that, or thought to share that. But she said, you know, it was also really interesting because her friends that she had made all this time reached out, and she really appreciated that. And she was able to look at those and think about those numbers of people and go, you know, obviously those 4 million people who shared that picture have never met me, because if they had, they would know how cool I am and how much fun I am. And she said, so maybe little by little, I'll get to meet some of those people, and they can recognize that, you know what, maybe what they did wasn't cool and wasn't okay. And that, I think, is just incredible. So you can watch her TED Talk. It's on there. And then the other thing we need is number 2. Do you have friends that like you for you? That's, again, the thing that Lizzie talks about. Who are your people? Who are the people you feel comfortable with? We don't need 1,000 friends. That's a heck of a lot of birthday cards to buy. But we all need those 2 or 3 people that we just feel comfortable. We can tell them anything. They like us just the way we are. And friends come in unique packages. They aren't always someone in your class. Maybe they're someone on your bus. Maybe they are a cousin. Maybe they're the neighbor. Maybe they're your coach. Maybe there's somebody at church. Your friends are from all over and all different places. They don't always have to come from the same place. But we also know that sometimes making those friends can be tricky. And that's where I really appreciate Josh Yount. He was a young guy who really had trouble making friends. He had different things that caused people to make fun of him. So things that were easy targets. So he had a lisp. He had a learning disability. So sometimes they would take him out of one class and put him in a different class for that subject. And he has a heart condition that when he's in gym class, kind of 5 minutes in, he's bright red and sweaty. And people like to make fun of that too. So he just remembers that when he had to move to a bigger school in another community, he said, there's going to be even more kids. Great. More kids to make fun of me. And he knew he just wanted things to be different. And he knew that if things were going to be different, it wasn't up to all the other kids in the school. It was actually up to him. So what was he going to do different? So he thought, well, let's give this a try. So he got up early, and that first week of school, he got to school early, and he just stood there and held the door as people came in. And there was about a third of the people walked by and went, okay, who's the weirdo holding the door? And then there was probably another third of the people who didn't even notice. Oh, sorry. And then another third of the people that stopped, said hello, said thank you. Hey, what's your name? Are you new here? So by a week in, he knew who the problems were going to be. He knew who wasn't going to be any help at all, but he knew who the safe people were. Who were the people he wanted to be friends with? And by the end of the week, he had somebody to sit and eat lunch with. And he had somebody to talk about his feelings with. Those safe places where he could go, oh my God, what is with Bob? Bob's always like razzing me. And the rest of the group going, oh yeah, welcome to the club, right? So he had somebody to talk to and vent with and feel safe with. So when we think about talking about our feelings, it's something we need to lean into more, not lean away from. And I always appreciated when the movie Inside Out came out, because that's exactly what it focused on, that there's always more than one feeling. There isn't just joy. There's going to be sadness. There's going to be fear. There's going to be disgust. But how do they all work together? And I love getting out a box of Smarties, as you can probably tell. And the thing about Smarties is, hello, red, blue, yellow, green, purple. Random. Huh. So what a great thing to pull out a box of Smarties, pull out some of the Smarties inside and say, okay, for every red Smartie you get, tell me something that makes you angry. For every green Smartie you get, tell me something that grosses you out. For every blue one, tell me something that makes you sad. Well, and we all know what to do with the brown ones. So that's what's really cool about getting together with a box of Smarties and just getting to know each other and using them to have a conversation. Now, sometimes every feeling doesn't fit within one of those 5 elemental feelings. And so that's where the feelings wheel comes in. I love to get it out. So there's the main feelings in the middle. But sometimes what I'm feeling isn't angry. I'm bitter. That's what it is. I'm bitter that nobody asked me this morning what I wanted in my coffee. Oh, yeah. Or, I don't know. I'm not really happy about the situation that's going on, but you know what? I'm optimistic. Yeah, that's the word I'm looking for. So the feelings wheel can be really helpful that way. And does your young person know what each of those feelings means? right? So we start in the center and we work our way out. Can they describe a situation connected to that feeling? And then number 4 to good mental health is, what do you do for fun? What do you do that makes you smile? We all need those things that work for us, regardless what's going on. We might have had the worst day ever. Might have had the worst week ever. But I know when I can take my karaoke equipment and sing with the seniors, that always grounds me. It always makes me feel optimistic, makes me feel better. What are those things for you? What are those things for your kids? Do they have enough of them? Do they need a chance to find some more? Is it all about exploring all sorts of things and finding the right fit? So when I think about things that make me smile, I give a lot of credit to Mr. Stacy Fenwick. He did a really great job of that this year. So here's a guy, and he got tagged in a 25-day push-ups challenge for 25 days. And he's like telling his buddy who tagged him, he's like, I am not like, the exercise guru. And he says, I don't know if I can do that. But he honored the tag. And he's like, well, if I'm going to do it, I'm going to do it my own way. So he made these goofy videos. He was in a banana suit one day. He was in a Speedo riding his motorcycle the other day. And he's just having fun. And all of a sudden, his videos started getting 1,000 views, 2,000 views, 5,000 views. And the next thing you know, he's getting messages from Australia. Hey, Stacy, saw your video. You made me laugh. I haven't laughed in months. Thank you. So I think Stacy did more for the mental health of Grey Bruce in that kind of time of frame than probably all 150 of our staff did that week. So I really appreciate that. And then, so we put all that together. And again, how able are we to handle bad stuff is a big one. So when I think about resilience, that's my bounce back factor. How quickly do I get back to my normal when things get in my way? Oh, Kim, I tell you, thank goodness you booked me to talk to West Grey Library folks, because West Grey, you know what? It's perfect. Life is perfect. Everything goes the way we want it to. We have lots of good paying jobs. There's lots of houses to choose from that are affordable. Nobody ever gets hurt. Nobody ever gets injured. Nobody ever dies. We never have arguments with people. It's great. Oh, sorry. That apparently is New Zealand. Oh, there we go. That's better. So when we think about life, and I apologize, I was being facetious. That wasn't what I intended. But when we look at life, there's always going to be blips in our road, things that don't necessarily go according to plan. And again, resilience is how quickly we bounce back in those moments, and what helps us. So when I think about blips, right, is it the loss of a job, loss of a person, loss of trust? There's all sorts of things that can get in our way. And what are those things that help us through? So there's the bicycle, there's the ladder, there's the zip line. What is it that helps us in those moments? So when I think about how do we learn resilience? So I look at this slide here. To be honest, the best way to learn resilience is to fail at stuff, right? Not be the best at it the first time. Have to do it again. That's where we learn resilience. So we learn it through learning a new instrument, sports, our first part-time job, getting outside, 4-H. God, I love 4-H. I pledge my head to greater thinking, my heart to greater loyalty, my hands to larger service, my health to better living for my club, my community, and my country. Oh my gosh, it's mental health in a can. I love it. But then what did we do as a society? Well, maybe we decided that some of that stuff wasn't fair, or maybe that it was too hard, or it took too much effort, or took too much time. So we took it and we tried to make it easier, as easy as we could. But what did we do as a result? Did we take out the hard? And did that cause us to not be as resilient as we were in the past? So I often think about that, and I often too think about social media. And social media creates a lot of expectation to look a certain way, to act a certain way, to be a certain way, to do certain things. And when I think about, they say when we first started taking selfies, they said we averaged about 16 pictures before we actually chose one to go online. Well, and then they removed that we didn't even need to do that because we now had filters. So we could change our pictures to fit with what we needed. And again, I don't know if that necessarily helped us. So when I think about what we need in terms of resilience, it would be great if we could go back to some more of this and bring more of this. And I truly believe that moving forward in our eco pandemic and taking care of our mental health, that we're going to need to add more of this into our life, that it will be the stuff that helps us. And so the other thing I just wanted to share just before we get into some resources is what's been really great is when we look at the triangle, there's been this incredibly resilient group of children and youth who weren't in the top, but who have been thriving and doing incredibly well in the bottom. And they are taking advantage of this time for opportunity to learn new things and help their community and grow through helping their community. So I know they did the food drive, West versus East, right? So Alexander versus Hillcrest. We have the young lady who did the marathon to raise money for the youth mental health beds at the hospital. Here's our graffiti ninjas at Paisley who go out at night with their chalk paint and put incredibly inspiring messages on the sidewalk. We have our rock snake that's been showing up at the hospital and Meaford. And then this young lady here, she made friendship bracelets and she sold them to her friends. She actually called them happy bracelets. I'm sorry. And she raised $600 and she split that between Canadian Mental Health Association and Keystone. And she's just a gift, cutest little thing ever. And yeah, so I have to give credit to all those folks, our young people who showed us how resilient we really can be. So we did a video where we took all that together and we put it in, we took all these different pictures and images from social media, and we made a video just celebrating all the amazing things our kids did in our area. So I hope you get a chance to look at it. If you search on it, it's focused on youth empowerment, and you'll just see all these stories of these young people. So when I think about what we can do to talk about resilience with our kids, sometimes it helps to talk about folks they may know. So I love talking about Bethany Hamilton, and the kids all know her. And they're like, oh my gosh, she lost her arm. She did, right? And how did she do that? Well, when she was surfing. But surfing was really important to her. So she kind of came to a decision. Do I keep surfing? Do I give it up? What do I do? Well, she tried again. That's the resiliency part. And yeah, it took about 1 million times falling off, but she got back on. Well done. Kids love to talk about these kinds of things. Mulala, there's lots of our youth that really identify with her. Here is a lady that was marginalized. She wasn't able to go to school in her country because of her gender. And when she tried to go to school, things didn't turn out really great that day. And she was hurt. And she, again, do I keep trying or do I just give up? Well, she instead kind of went through the middle. And she said, I'm going to use my voice. I'm going to use my voice to let people know what was happening in her country and the laws that were there. And as a result, this young lady has made a lot of changes happen with her story. And that's just incredible. For our young guys, a lot of folks identify with Stephen Hawking, and just the fact that here's a gentleman that his physical health got in the way of his goals and his dreams. And he was able to overcome so much of those challenges, getting himself a cool wheelchair that went up into space with him, using a machine to talk. Lots of kids use machines to read, to write. And then Henry Winkler, if you've never had a chance to look him up, and his story, so he's the Fonz, but you may not know that as a kid, Henry couldn't read, couldn't even write his name. But he graduated high school. And he did it without credit recovery, without extra support, in terms of having a great person like Kim to support him in his literacy. So what he did was he wanted to learn. He loved learning. He just couldn't write it down or read it. So he would come home, mom would read the questions. He would say the answer out loud. She would write it down. But then he would take a blank piece of paper, put it over top, and he would trace it because he still wanted it to be in his handwriting. Isn't that incredible? I just love that so much. So that's Henry Winkler, if you get a chance. And the other person that, if you do get a chance to listen to, his name is Dr. Michael Unger. And this is all he does, is he talks about kids and resiliency and how do we give them the tools they need to move forward, to be the next Malala, to be the next Bethany Hamilton. He said, imagine the audacity to think that learning as we go through a pandemic and taking on these new tools and people and supports, imagine we come out of it an even more improved version of when we went in. And so that's him just saying about what kids always need in terms of the things at the bottom, our nets, our safety nets. Once they have all those things, great things can happen. So if you get a chance, that's Dr. Michael Unger. And so in terms of supports in the community, that's always my last slide. So where do we go? Jackie, I did your survey. I did the mental health test. Okay. 2 of them I did really great. 1 of them maybe not so good. And that whole thing around stress, yeah, guilty right there. Where do we go for help? So in terms of our kids, your kids, oh my gosh, what do we got? Thank God we don't have a lot of Cameron Diaz's around. Woo, phew. Instead, we have all these other people. We have co-op teachers, teachers in general. We have guidance. There are a ton of child and youth workers within the 2 boards. We have our school administrators. Oh my gosh, the secretaries, our VPs, community partners that come into the school, choices, addictions, support for the high school age. We have mental health nurses that can come and do assessments and refer out in the community. You can request those referrals through your principal. So there's so many people that want to help. And then Keystone is our children's mental health lead agency. They take intakes all the time. You can call every single day. If you ever think to yourself, I don't know if what my kid is experiencing is normal based on the pandemic, or if it's just not normal, period. Well, if you ever catch yourself thinking about it, then this is the right time to call Keystone and ask, because this is what they do. They're all about making assessments. They tend to work in a clinic format. So the Hanover Clinic runs Wednesdays, the Owen Sound runs on Thursdays. If you don't get into it this week, hopefully you'll get into it next week. And as of June, this past June, there is a Keystone worker right on site in the Owen Sound Hospital that can do an assessment within 2 hours. Amazing. Thank you. Pandemic funding. Again, one of the silver linings. School Mental Health Ontario is your page. It is just for you. It is all sorts of information on how to support my kid in going back to school. What kind of things do I look for in my kid? How can I support it? How do we talk about mental health? So School Mental Health Ontario, super easy to find for educators, for parents and families, and for the kids themselves. So they just recently put out their, so this one's 2020. So they have a whole page on how to support your child as we go back to school. And then in terms of other supports, look at all these great things, right? How do I support my child with their mental health? How can I access help for my child or teen? How can I improve or protect their mental health during a pandemic? There's all sorts of things in there. Kids Help Phone, Kids Help Phone, Kids Help Phone, Kids Help Phone. Could I say that a million times? It is for everybody under the age of 25. What they found during the pandemic was a lot of adults even called because they're like, hey, I found your number. I didn't know who else to call. Is it okay if we talk? And Kids Help Phone was like, absolutely. But when we're done, we'll totally use our database and we'll find you who the other people are in your community that you can reach out to next time. So in 2019, they had 1.9 million calls, and they were all excited in 2020 to finally get to 2 million. They're like, this is the year we're going to break 2 million. Boy, did they ever. 4 million calls in 2020. So they hired a ton more counselors, but you know what? It was the first time ever in their 30 years existence that they got federal funding. So Justin Trudeau in April of 2020 announced $7.5 million for Kids Help Phone. first time it was received government funding. Again, 75% of the calls in that time were COVID related. And what did we remember? Down went bullying, all sorts of things around some of the school stress, because we maybe were able to work at home in a quieter space. And so again, there were some kids that actually did better with their schooling. But what they did notice too was that the number of rescues they had to do a day in Canada did go up. And so before they were averaging about 4 a day of young people that they maybe had to get an adult on the phone and say, you know, I just talked to your young person. Thank goodness they called. I think we need to take your young person to the hospital. Or they had EMS or police sent to the young person's home. Again, some people look at that number and go, wow, that is a huge spike in the number of kids that needed that support. But you know how they got that support was they called Kids Help Phone in the first place. And that's what we celebrate. So when we think about why you would call Kids Help Phone, it is a person who went to school for psychology, masters. These are people who are $300 an hour counseling for free. 71% of people that called said, you know what, I just needed that one call. Thank you. You validated what I was feeling. You gave me some really great ideas. You reminded me that I'm not the only one. And that just truly made a big difference. 69% shared something with that counselor they had never shared with anybody else. Maybe they needed that anonymity. Maybe it was just the questions that they asked them. But how amazing is that? And 49% said, you know what, if I hadn't called you, I would have just kept going and hoped it would get better on its own. So boy, am I ever glad I called. Again, not everybody does well on the phone. And so there's the Kids Help Phone text line. Absolutely. The number of people that have used the text line since it came out went up, while the number of people that reached out to Kids Help Phone on the phone went down. So this works for a lot of people. There's their website. To be honest, the website is for you. You go in, you write in there in the search bar about maybe something your kid is experiencing, and it's going to come up. Again, it's for you in terms of having conversations, right? I love that. Is my relationship healthy? What a great thing to check out with your tween and your teen as they got to move into that part of their life. And then the letter writer guide is really cool. 69% shared something they'd never told somebody before. Was it the safety that was created by that person? Well, there's the letter writer guide. So here is a way I can write things down, turn it into a letter, email it to my teacher, my parent, my guidance counselor, my social worker, just stuff I've been carrying around, and now is the right time to get it out. But how incredible, that person I send it to also has a little while to kind of read it and go, wow, I didn't know. Let me do some research and find the right fit. And then when we connect on Monday or next week, I got what I need. I've got some tools ready to go. West for Youth Online has been around for about 7 years now. It is a little different than Kids Help Phone in that it's not real time. You can't just get somebody on the phone right now. But the difference is you're going to always be talking to the same person, which you can't do on Kids Help Phone. So if I got to talk to Kim last night, I can't call the Kids Help Phone tonight and ask for Kim. It just doesn't work that way. But West for Youth, once you pick your counselor, that is the same person you message back and forth with all the time. It's all done online. It's not done through email. So it's super duper secure. It's more secure than your bank. And these are the numbers they were noticing. So this was just this past May, 111 new kids. To be honest, that's more youth signed up for West for Youth in that 1 month than all of 2017. That's incredible. And the average age is 17, and there's all the things that they love to help kids with. In terms of keeping kids safe online, holy crap, is this the perfect storm for safety and our kids? All those things we tried to do to keep our kids safe online, well, we've pretty much thrown them out the window because they're online way more than they ever were before. So what do you know about online safety? So there's our go-to center, the Canadian Centre for Child Protection. In there is 2 specific resources. So there is, I am the parent, I am the adult, I am the caregiver. What do I need to know? And all sorts of information for your kids as well. the bottom one there is the what if, is I'm kind of coming at it a little too late. Something has happened and I need to know what to do. That's what that book is for. It's free to download, and it's got all sorts of conversation starters, questions to ask, what to say and what not to say. And then there's the kids section of that website. Lots of age appropriate, right from JK all the way up. What do we need to know about being on the computer that can keep us safe? Because stranger danger doesn't work so much anymore, because it isn't just who you come into contact with face to face, but who you come into contact with through the screen. I love Sesame Street. They have monster meditation. Hello, yes, please. And there is Dr. Cheddar from Sick Kids, and they put up a video kind of every other month or so. And there's Dr. Cheddar just talking to your kids about the pandemic and how to stay safe and vaccines and all sorts of information just for kids. There's Jumpstart. Please look up Jumpstart. It is available online. You don't need somebody to do it for you. You can do it yourself. You pull it up. So in other words, you don't need a referral. And when you go on the site, oh my gosh, it up to 18. It also covers art and dance. It isn't just sports, which is awesome. It is based on your overall gross income. So it's good to kind of look it up ahead of time. Sometimes they pay the activity directly. So they pay the dance teacher, the hockey coach, the soccer, and voila. I love that. So that's Jumpstart. Totally check it out. And then 211 is just the go-to for information. So it is anything and everything to do with what's available in my community. That would be, to be honest, another 45 minutes, and I only have 5 more minutes left. So that's where you're going to find everything municipal and social services. So I moved from Hanover to door knock, and I don't know what day my garbage goes out, and I'm go to work way too early to spy on my neighbors. Call 211. They can look it up. I'm not sure we're going to afford the backpacks this year, just with everything going on. Call 211. There's all sorts of information in there. And then the last couple minutes here is you guys. When I think about, to me, the one that always makes the most sense is we're in the airplane, we're losing oxygen, the face masks come down, and what do they tell you? Put the mask on you before you put the mask on those around you. And that's what we need. So here's our supports. There is Wellness Together Canada. It came out super early in the pandemic. It is the 4 parts of good mental health, checking to see how you're doing online. It's just a few questions, really super easy, really easily worded, so they make sense. It's going to give you a color, green, yellow, red. If you identify in the green, hands up, right? You're doing great. Whatever you're doing, keep doing it. If you're in the yellow, again, celebrate, keep doing it. But maybe think about adding a couple extra things. Red, you know what? Maybe it's time now to get down here to the bottom and click on that number to arrange for some phone counseling. This is great. When can we ever do phone counseling within 24 hours? That doesn't happen in our services. It's going to be a little bit of a wait, but through this website, you can speak to a counselor within 24 hours. It's just incredible. And then you can also text someone if you need it. And that is instant. You don't even have to wait the 24 hours. So that's Wellness Together Canada. So then as well, if you have access to benefits, use them. Benefits is like a bank account. It's already money in your account. It's yours to use. It's not a loan, it's a credit. So use it. It's really great if you can phone the number on your EAP and just talk to the person. What's available to me? What's my limits? Is there massage? Is there not massage? Ask these questions, because maybe there's things in there you never even knew. Oh my gosh, I did hear about being a vegan, but I don't know if I'm the right fit for being a vegan. I can call my EIP. They'll send me a whole bunch of stuff to read and check out on my own time. There's all sorts of things. Lots of EAPs even have access to a virtual doctor. So many of them do. And that's incredible. So I'm maybe am an orphan patient. I don't have a doctor. Maybe I still do, but I just can't get into them till like next October. Well, your EAP sometimes has access to a doctor. So check it out. Always call in and ask those questions. Here are our offices. That's where you can find all our mental health supports. So it tends to be by geography. So even though you don't have to go to our offices right now, this is where they're going to put you based on what your address is. And these are all the things that are available through the offices. So these are kind of our core supports that you're going to find, whether you're in Markdale, Hanover, or Owen Sound. These are all the things that are available under the CMHA roof. There are some extra supports in the clinic community in terms of addiction support. There is also, I think of all the self-help like AA, Al-Anon, Alateen, Narcotics Anonymous, NA. That's for folks who are staying, are looking for harm reduction in terms of opioid use, painkiller use. So there's all sorts of great programs out there. And then Bounce Back has been a game changer. This is actually counseling support that you would do, that CBT, cognitive behavioral therapy, stuff I would do with a counselor, but I get to do it from the comfort and safety of my own home. So I actually get to try it out on myself first. So it's all workbooks, and you register online. You can register yourself. You just need to be able to put a doctor's name in the square, because they're just going to get an update. Hey, Jackie did the one about avoidance. Good. I'm trying to get her to do that kind of stuff. Oh, she actually did the one about increasing exercise in her life. Also a good thing. So they just get an update of what books I've worked on. And then I get a coach, and the coach just calls and checks on me every now and then. Did you like the books? You want to try another one? Do you want to try the one about being more assertive? Yeah, I do actually. Right. So these are just some books that I can get to my home. They're mailed. I do them on my own time, but I get the support of a coach. There are 3 separate books. There are adult versions, youth versions are kind of 15 to 18. And then maybe I don't sit really well at long periods of time, and there's short ones. So that's maybe easier language, shorter paragraphs, that kind of thing. So that's, again, just a couple of screenshots of some of the different topics you can check out. So my last slides here are, okay, Jackie, I've done all that. I tried the books. They were really helpful, but I'm still stuck. I just haven't been able to get up out of this feeling I've been carrying around. Well, now we need to really think about who we're adding in. So our mental health crisis line of Grey Bruce is available 24/7 to all the phone numbers in Grey Bruce, all of the 519s. If you have an out of town phone number, well, we have the Canadian crisis line, 833-456-4566. Either way, you're going to get somebody on the phone who's there to listen, to let you vent, to let you feel angry, to let you feel upset, to let you feel sad. And then they're just going to, again, reassure you that you're doing great. They validate that these feelings are real and are important and have value. And maybe you also get to brainstorm some things that can help. Here is victim services. If I have gone through something traumatic that really, really knocked me over for a little bit, call victim services. You'd be amazed how many supports are in there that we didn't think to access. And then here is the crisis room at the hospital. It is a special room that opened literally January 2020. We didn't even know the pandemic was coming, but thank God it's there. And this is a room to access an on-call psychiatrist, on-call social worker, addictions worker, peer support worker, family support worker. It's off to the side of the emergency department in Owen Sound. It's 24 hours a day. If I have to wait about an hour or so for the psychiatrist, these little chairs turn into beds, and there's pillows and blankets so I can get comfy while I wait. And then the last thing here, I got to wrap it up, is this is Brene Brown. She has been my go-to, and she spoke early on with Matt Galloway, a Grey Highlands graduate, just saying. And it truly was the conversation that changed my view on all of this that was going down. And she said, you know, sometimes when these things happen, we're waiting for Superman to show up and save us all. And she said, and in those moments, we sometimes recognize, wait, I can be Superman. I can maybe do some things to help. Absolutely. But that also reminder that getting through a pandemic is not going to be easy. There's no perfect way to do it because we've never done it before. And so it's going to be hard. It's going to be new. And there's going to be missteps. So forgiving ourselves and forgiving the folks around us who maybe we come into contact with that maybe they're not dealing with it as well either. And in those moments when we come face to face with people who maybe are dealing with the pandemic as their worst self, as they're scared, maybe those are those times when I can pull into me and react to my best self. And that's going to take a little bit of bravery. It's going to definitely take some kindness, and it's going to 100% take some awkwardness. So what can we do to fill up our bucket? So Jackie, that's a lot of stats. It was very depressing. And so you got some good news for me? Yes, I do. When I think about self-care, my list is pretty easy. I just need $1 million, a room full of puppies, and a hug from my grandma. But not all of them are available all the time. So we reached out. Kim would really like this. We did a letter writing campaign, Kim, and we sent some requests out, and we said, hey, to the elementary kids, if you knew that someone was struggling, what would you want to say to them? And these are some of the letters we sent out. We thought, when we did the letter writing kit, we thought, oh, maybe we'll get 50 letters, 40 letters. Gosh, we'll be happy if we get 30. We actually got requests for 600 letter writing kits. So we had sample letters, blank coloring pages, and we received so many great letters back from the kids. Kate, I hear you're having a rough time. Well, I'd like to tell you we all are. And here are some things that make me feel better. I love drawing and seeing animals, but my favorite thing is making people laugh. So here's a joke. A waiter comes up to a man and says, how would you like me to take your order? Very seriously. Love it. And then this one. I hope you're doing well. The sun is bright, and so are you. Always think positive. You will see your family soon. Never give up on who you are. Be strong. Always be strong. Mistakes are proof that you are trying. Just be you, because that's the best part of you. It's been hard, but don't give up. You are amazing no matter what. And don't give in on the negative things people will say about you. Be happy no matter what. And I hope you have a great year. And the artwork that came with it. And some of them colored the sheet we had sent that said, you know what, this world is a better place with you in it. And it 100% is. So for all the parents and caregivers and staff members of the agencies who are getting into that arena every single day, if you don't hear it enough, I hope you hear it right now, how awesome you are. And you got through 18 months of a pandemic. That was hard. It was tough. It was awkward. It was something we had never done before. And you're still here. And so how incredible of a feeling that is. And thank you. And I hope that with all these supports, with all these access to information, that as a community, we can get back to feeling our regular self and find all those things and re-find our joy and our center. So this is me. This is what brings me joy. Kim is definitely part and parcel to all this, but I also love karaoke. I love bonfires. I love my husband, my anxiety cat, who reminds me when I'm not doing so good, and my family. So if you ever have any questions, because I know I talk fast to try and fit probably about 75 minutes into a 60-minute presentation. So if there's anything in there you'd like to reach out about, there's my number, there's my email address. Oh, that's our old website, graybruce.cmha.ca. Jackie, update your slides. Awesome. So thank you, Kim.
Jackie, you're beyond wonderful. It's so great to hear you, and especially to hear the great information, but just your personality's there shining through like it always is. So thank you so very much. And I hope that the other people who are tuning into this later on get the same charge out of it as me. I literally have laughed and cried. So thank you again. Have a wonderful evening. Thanks so much.
You're welcome.